We also continue our special report about the COVID vaccine and the Black community. And in part one, we talked about why some people are hesitant to get immunized. And now you'll hear California's top leaders as they hope to change that.
Now they're calling on faith leaders, doctors, and community activists to help build trust in vaccines. As KCRA3's Brittany Johnson found out, the plan is receiving mixed feedback.
California's COVID-19 vaccination plan, 80 pages. Part of the communication plan to target African-American communities, partner with faith-based organizations to rapidly disseminate information and ensure these groups have access to vaccination.
We need to do a better job partnering with our diverse communities, our faith leaders.
Pastor Daryl Scarborough of Boss Church in Sacramento says keeping his congregation informed is something he will do, but won't tell them what to do.
We have nurses and doctors at our church, so we will give them all the information, but I will stop short of suggesting that they take it. That is not the role or the responsibility of me as their spiritual leader to push that agenda.
Boss Church hasn't held any in-person services since the beginning of the pandemic. And although Scarborough wants to get back to a sense of normalcy in the coming months, he hopes progress is made on multiple fronts and adds relying on a vaccine alone is not the answer.
So many churches I know are fighting, they want to meet, they want to get together. We have not done that simply because I need to make sure my people are safe. I have a different population than many churches. 40% of our church is white, but 60% is African American and Latino. And so I have to be cautious of how it disproportionately affects them. And so I carry, some more responsibility to how I deliver that message, another level of urgency, but at the same time, I'm cautious as to how hard I push the message.
How aggressively to push the Black community to get the COVID-19 vaccine is debated. Keenan Jackson of Eminent Domain, a Sacramento-based barbershop, is skeptical about the vaccine. He says it will take something drastic to change his mind.
It'll have to be something literally in my face. Like, I would have to see somebody flat out right now in this shop die from COVID on the floor. So until that is, then that's when I'll be like, okay, for sure, let me go get my vaccine. But other than that, no, I'm cool.
Well, our focus is
Dr. Anthony Harris, Chief Innovation Officer and Associate Medical Director for WorkCare, says dying from COVID-19 is a possibility, but there are other medical risks that need to be considered.
But we know that this disease goes far beyond mortality, right? Let's talk to the gentleman in the barbershop sitting across from you that has erectile dysfunction now because of the virus. We know the virus can cause erectile dysfunction. Let's talk to the young lady sitting getting her hair done that now has history of a stroke, right? Because we know the virus can cause a stroke or heart attack. There are other clinical outcomes that can lead to permanent, and in some cases, as well as temporary illness and disease that we need to protect our community from. It's not just dropping dead. It's about quality of life.
Right now, California is in its phase 1 plan of distributing the vaccines. Healthcare workers, first responders, and people in long-term care facilities first in line. When the state moves to phase 2, which includes more of the general population, messaging will include providing credible vaccine information to dispel myths, partnering with community-based organizations, and utilizing social media.
2020 has proved much that is lacking in the area of trust between the Black community and the country. And so I think there's going to have to give some patience in our congregations and our churches and our leaders to allow people time to digest what's coming at them.
If we're fighting for equality, and this is our opportunity to have an equal proportion of this vaccine allocated to us, then we should double down on those efforts because we want to be in a population that is protected from this virus that has disproportionately killed more of us than our white counterparts, right? And so if we're talking about equality, if we're talking about equity, if we're talking about access to healthcare, quality healthcare, this is our opportunity. And to pass that up would be a disservice to our brothers and sisters in our communities nationwide.